Hello, I'm Dr. Cynthia Mace, Sonoma County's health officer. I'm here to share the latest updates on coronavirus in Sonoma County with you. As of April 24th, there are 216 confirmed cases. We are up 22 cases since yesterday. 121 are active, 93 have recovered, and we still have the 2 deaths that we've reported. We've now performed nearly 5,000 tests. Why do we have 22 new cases? Well, I'm happy to say that the majority of the cases that we've identified in the last 24 hours are from our intensive contact tracing and testing. And we still have very few cases of community transmission. I'd also like to remind you that the drive-through testing for healthcare workers starts this weekend. That is tomorrow. And this is going to happen by appointment only. So we've received a number of questions about the type of healthcare workers that would be tested. I want to make it very clear that in-home support service workers are not being tested at this time, but they will be included in a subsequent at-risk group for testing. Unlike healthcare workers, IHSS workers don't work in group settings with people who are currently sick with COVID-19, so they'll be tested in a subsequent priority group. If you're a healthcare worker who meets the criteria for testing, that is, you're working in any healthcare setting, I'm going to give the criteria in just a minute, you should call 707-565-4667. Again, 707-565-4667 to schedule an appointment. We're starting tomorrow, but we'll continue testing throughout the week and onwards until we've tested all of our priority groups. So a healthcare worker is defined as any individual employed at a healthcare facility whose job duties put them in direct contact with patients regularly. This includes medical staff, such as nurses, nursing assistants, and doctors, respiratory therapists, phlebotomists, lab workers and technicians, in-facility pharmacy staff, social workers and counselors that work in healthcare facilities, front desk intake staff, dietitian, housekeeping, and janitorial staff, because they are cleaning the rooms where patients were seen, and security that are working in healthcare facilities, since they may also interact with patients. So please do call 707-565-4667 if you're a healthcare worker who's either symptomatic or asymptomatic, and we'll get you an appointment to be tested in our drive-through site at Shin 8. I'd also like to answer the few community questions for the day. How can we know that our tests are reliable? Are there a lot of false positives and false negatives? The tests that we are using are highly reliable in patients with symptoms. We sometimes see false negatives in people who've just contracted COVID-19 because there's not enough of the virus in their bodies to be detected. It's also important where on the body a sample swab is taken. The CDC recommends taking a swab from inside the nose. This is called a nasopharyngeal or NP swab. We also do oropharyngeal swabs if we can't do an NP swab, and those are have slightly less sensitivity or the ability to detect the virus. There are also 2 kinds of antibody tests. These can have some challenges as well. If testing occurs too early before antibodies appear, these tests could be false negative. Also, the antibody tests are not specific to COVID-19. They can pick up other antibodies from other non-COVID-19 coronaviruses and therefore be false positive. One more question for the day. We're hearing about some of the restrictions on the parks are being lifted. What will these be? We hope to allow some limited use of parks by the public by next week. I will be releasing a revised health order about the parks soon that will take into consideration the ability to implement some safety and health measures to keep everyone safe. So thanks for joining today, and we'll talk on Monday. Take care of yourselves and stay healthy.